Okay, the Navier-Wheeler equation. It's a formula used to calculate the best dosage of a certain drug. Most of the time, tablets go into the aqua solution of the stomach where it dissolves. The dissolution is different from drug to drug, so it's very important to avoid drugs from dissolving too quickly or too slowly, because it could cause a negative effect in the patient. We follow the next formula, where derivative of W over derivative of T represents the dosage rate. That will be equal to the diffusion coefficient times the surface area of the solid. All that times the concentration of the solid in the diffusion layer surrounding the solid minus the concentration of the solid in the bulk dissolution medium. All that divided by the diffusion layer thickness.
Calculus is also useful in pharmacokinetics, which is used to calculate the course of a drug through the body. There are many formulas, such as the formula for absorption, which uses the constant absorption of a drug, the dosage of the drug in milligrams, and bioavailability, which is the amount of the drug that has been absorbed over the total amount of drug in the body. There's also a formula for elimination, which is the constant elimination of a drug, the concentration of a drug at a given time in hours, and the total volume of the drug in the body. This last formula, which is a little bit more complicated, is used to model the course of the drug. So it would give a positive slope during absorption and a negative slope during elimination.
Also, calculus can help us calculate how fast is a tumor growing or shrinking and how many cells it have. With a method called the Gompertzian method described by this formula, in which V is the volume at a certain time, N is the number of cells, W is the weight, A is the growth constant, and V is the constant for growth retardation, it can indicate us how the growth rate declines over time due to prolonged cell cycle, the decreased oxygen or nutrient availability, and the increased rate of cell deaths. As time approaches infinity in this formula, the size of the tumor is limited. The rate at which the tumor grows is directly proportional to the volume. That means larger tumors grow faster and smaller tumors grow slower. Also, the growth over a short period of time, usually at the beginning of the formation. And it implies that a tumor would grow continuously, doesn't take into account factors that could slow down the growth or completely stop it.
Finally, the amount of blood pumped through the heart per unit time is the cardiac output. This is measured by injecting a dye to the right atrium so that it flows with the blood into the aorta. Then how much dye leaves is measured with a probe until the dye runs out. The cardiac output is this. Well then, going on. The blood flow in an artery or vein at a given point in time is given by this equation, which is known as the Poiseuille law. It shows that the flux is proportional to the fourth power of the radius of the blood vessel.
Sí, aquí cortas, ¿no? O sea, esto no lo incluyes o sea, esto no, o sea, esta parte no la pongas en el video. Me aquí pon una cebra, aquí pon a Noé, y aquí pon tu cara, por favor.